Hello everyone, and welcome to our presentation on typhoid fever by Catherine and Pang. In this presentation, you will learn about typhoid fever, what it does, who is affected by it, the symptoms one might have, what was known about it in the past, its history, and lots of other interesting information. Typhoid is a common worldwide bacterial disease transmitted by the ingestion of food or water contaminated with the feces of an infected person. This person has a bacterium called Salmonella typhi. Typhoid fever and paratyphoid fever are clinically indistinguishable diseases, collectively called enteric fever. Typhoid fever in the United States has decreased since the early 1900s, and tens of thousands of cases were reported in the U.S. Today, less than 400 cases are reported annually in the United States. Worldwide, typhoid fever affects more than 21 million people annually, with about 200,000 people dying from the disease. Typhoid fever used to be endemic in many currently developed nations. In fact, scientists have for several years debated whether typhoid fever was the cause of the plague of Athens. Analysis carried out by Manola Papagrigokis and colleagues using DNA collected from teeth from an ancient Greek burial pinpointed typhoid fever as the disease responsible for this devastating epidemic. The history of typhoid was traced back to 430 to 424 BC with the plague of Athens. The plague, which some believe to have been typhoid fever, killed one-third of the population of Athens, including their leader Persiles. The balance of power shifted from Athens to Sparta, ending the golden age of Persiles that had marked Athenian dominance in the ancient world. Who was known for the disease? The most notorious carrier of typhoid fever was Mary Mallon, also known as Typhoid Mary. In 1907, she became the first American carrier to be identified and traced. She was a cook in New York. She is closely associated with 53 cases and 3 deaths. After the indigestion of contaminated food or water, the Salmonella bacteria invade the small intestine and enter the bloodstream temporarily. The bacteria are carried by white blood cells in the liver, spleen, and bone marrow, where they multiply and re-enter the bloodstream. Bacteria invade the gallbladder, biliary system, and the lymphatic tissue of the bowel. Here they multiply in high numbers. The bacteria pass into the intestinal tract and can be identified in stool samples. If a test result isn't clear, blood samples will be taken to make a diagnosis. The symptoms of typhoid are divided into 4 individual stages, each lasting approximately 1 week. In the first week, the temperature rises slowly, and the infected has fevers on and off. They often have a headache and a cough. A bloody nose is seen in a quarter of the cases, and abdominal pain is also possible. There is a decrease in the number of circulating white blood cells. The second week, the patient has a high fever of around 104 degrees Fahrenheit. Rose spots pop up on the lower chest and abdomen in around a third of the patients. The lower right abdomen is in pain, and the patient usually has green diarrhea. The spleen and liver are enlarged and tender. In the third week, intestinal hemorrhage can occur. Neuropsychiatric symptoms, described as a muttering delirium or coma vigil, may occur with picking at bedcloths or imaginary objects. The fever is high, the patient is delirious and very dehydrated. All of the symptoms include abdominal tenderness, agitation, bloody stools, chills, confusion, difficulty paying attention, delirium, fluctuating mood, hallucinations, nosebleeds, severe fatigue, slow, sluggish, lethargic feeling, and weakness. In 1909, Frederick Bessel, a U.S. Army physician, developed an American typhoid vaccine, and 2 years later, his vaccination program became the first in which the entire Army was immunized. They eliminated typhoid as a significant cause of morbidity in the U.S. military. Now it is recommended that one gets the vaccination before traveling to a country that is known to have a lot of typhoid cases. A vaccine is recommended to travelers, especially going to Asia, Africa, Eastern Europe, and Latin America. We found that vaccines were the only societal concern for some people who do not believe in vaccines. The Central Disease Control and Prevention website has more information about common typhoid areas. Typhoid is treatable with antibiotics. Fluids and electrolytes may be given by IV or you may be asked to drink uncontaminated water with electrolyte packets. Antibiotics are given to kill the bacteria. There are increasing rates of resistance. Typhoid that is resistant to certain agents is called multi-drug resistant typhoid. The different agents that typhoid can be resistant to are ampicillin, chloramethylnesyl, trimethoprim sulfate methylsolate, and streptomycin. Ciprofloxacin resistance is a major problem, especially in the Indian subcontinent and Southeast Asia. 70% of people infected come from international traveling. When traveling, drink only boiled or bottled water and well-cooked food. Water treatment, waste disposal, and protecting the food supply from contamination are important public health measures. Carriers of typhoid must not be allowed to work as food handlers. An interesting fact about typhoid fever is that the time period that a person can have Salmonella typhi in their stool is variable. About 10% of untreated patients may shed infectious bacteria in their stool up to 3 months after onset of symptoms, and 2 to 5% may become permanent shedders. Many complications can occur, including bacteria, pneumonia, gallbladder, and more infection, causing many untreated patients to die. About 10 to 30% of untreated cases will go away. Thank you for watching our presentation on typhoid fever. We hope you enjoyed your presentation and learned something new about this topic. If you have any questions, please feel free to ask.